Hello, and welcome to another episode of Low Tech Health. Let ourselves translate expert knowledge. June is over. July. Today is Wasabi Walnut What's Hurting My Tummy Wednesday, and I'll tell you, I had one of the weirdest nights I've ever had in a hospital last night. Got a patient with transfer orders from the ICU, which means that they're going to a regular floor. They're getting better for all intents and purposes. They're hemodynamically stable. Their blood pressure is no longer up, down, all over the place. Their heart rate is well controlled. Not perfect, but controlled to the point where they will perfuse their body and their blood pressure will sustain it. Their oxygen's fine. They're on a little bit of supplemental respiratory support, 2 liters, nasal cannula. It's fine. He can go to the floor. I'm getting him a bath. About 9:30, I tell him when we're planning to do it. Get him cleaned up, roll him left, roll him right, change the sheets, get him cleaned, and a little bit of activity. I expected his heart rate to go up from his baseline of 110s, 120s, which he is in atrial fibrillation, the weird quivering irregular heartbeat that doesn't fully empty the blood of the heart, causing regurgitation, which is backflow, bad flow. Throwing clots is what happens. So, I was a spider on the screen. Spider, get off of my video camera. So I roll him left, roll him right. Heart rate's up more than it has been. 130s, 150s. It keeps climbing. We chill out. We sit. We're calm. And it gets worse. His pressure goes down. He's crashing. I have to call a different team than the doctors that are on the floor because, of course, he has transfer orders. He has a different team of physicians following him. Luckily, they were on a floor next door, came and saw him. All intents and purposes, he's controlled. They thanked me for a really calm, what they would recognize as a rapid response on this DNI patient, which is do not resuscitate and do not intubate. So it takes a little bit of the wind out of your sails if you know that you have very limited amount of treatment that you can do. Because he's 91. He's 92. He's in his 90s. He's had his life. He's starting to really fall apart. This is his 3rd admission for pneumonia. But he may be stable. We may be able to get him out. That's cool. He's not. He gets worse. He goes into a state of unresponsiveness, but not before repeating something after this albeit confused man had been talking to me, understanding, hey, I'm going to get you some Tylenol, I'm going to get you some of your medications, how about some applesauce? Conversing makes sense. He's responding appropriately to questions. He starts repeating, I gotta go. Oh, I gotta go. I gotta go. I gotta go. And this is as I'm treating, I'm giving him some fluid, I'm repleting his magnesium, repleting his potassium. I got to get a new IV in him. He's telling me, we got to go. We got to go. I got to go. Really, I got to go. It's time for me to go. I got to go. And I'm thinking he's wanting to get out of bed. He's not really even impulsing or having that impulse to move towards the rails to try to get up out of bed. And I get an IV in his hand. And he says, perfect, perfect, perfect. I move over to his other side and trying to get another IV because, of course, the one his bolus is going into goes bad. It's leaking all over his pillow. He's raising his arm. He's following commands. He's moving with me, and then just nothing. Won't even respond to a chest rub, or we do a sternal rub, which is where you take your knuckles to see if they respond to pain. One of the last resorts to see if a brain is firing to help respond to pain, using his rib cage as a washboard, and it's awful. But he doesn't respond, gets worse, and he inevitably passes. I speak to his son afterwards, and he tells me that this man's girlfriend, where he came from, the assisted living passed last night. He was dreading telling him. I think he knew. He knew he had to go. He knew he had to go, and he knew it was perfect. And I want you all to know that just because it's July 1st, nurses, healthcare workers, anyone who knows the inside of a hospital knows the residents are coming. People who haven't seen patients in a little bit, but they are medical students. They have given their 20s for this. They've given up what normal college kids do to treat you and to save your life. And because they're new, they will try even harder, and they will examine every diagnosis because this is their life's effort. So don't try to minimize someone just because it's their first day on the job. He's born for this. The man who passed's grandson was named Brad. And I knew from the way he said my name that it wasn't just my name he was saying. I was meant to be there. You're meant to be there. Be here now. And to tie this all into the flexibility of life, I went back into my other patient's room and continued my job. Because he was better. He was okay. He's getting better. He doesn't need to know what I just went through. And he won't. He can't. There's another thing to tie this into the Wasabi Walnut What's Hurting My Tummy Wednesday. Before he started repeating, it's time to go, it's time to go. Perfect, perfect, perfect. He said his tummy was hurting. And it just become pretty firm. I don't know what was hurting his tummy. But I'm going to go back tonight. Because that's the flex that we do. Thank you all for listening. I look forward to seeing you 2 days. I'll forgive my foul mouth Friday. Hope you have a wonderful July. I love you all. See you soon.